You are not alone. Okay, I'm gonna turn my mic off and I think you guys are good to go.
All right. Good afternoon. My name is Steve Pratt and I'm the Chief Executive Officer. As we've been talking every day, I'm just trying to keep the community up. Talk very important topic that's mind. Help at the hospital become ill to be able to call in. So we're trying our best to help support people as we're practicing social distancing and self-isolation or required isolation that's occurring, and really helping to minimize our interactions that are happening. So through all of that, it can definitely present some challenges on the mental health side. So I'd like to introduce Megan Walker, who is going to walk us through some things that we could all be doing to help.
Yes, thanks for having me, Steve. So the biggest thing I think right now is having the mentality that taking care of our mental health is just as important as our physical health. Now more than ever, we're seeing, rising feelings of anxiety and stress and fear about what's happening, and it's completely unprecedented situation. So I think we're all trying to cope in our own way with it. So we need to continuously be taking care of our physical health, but also doing some mental health check-ins as well to see how am I coping with this and what's working or what might not be working so well for me.
So as we're going through and doing all of that, what would some things be that you'd like to share with folks on some practices or maybe some kind of tips that would help them just be able to manage the new day-to-day?
Mm-hmm. So I would say self-care is the most important thing right now. So I kind of equate that to, we're told at a very young age to be physically active each day, to take care of our physical bodies, stay healthy. Self-care is essentially that for our mental health. So it's doing things purposely each day that, make us happy or relax us or kind of like a stress relief activity for you. And it really kind of builds that resiliency muscle, if you want to think about it in that way, and kind of helps foster positive mental health. So one really big thing right now is staying connected. It looks a lot different now than it may have in the past because of that distancing, right? But there's still, we kind of have to get a little bit unique with the ways that we're connecting, but like this, right? Connecting virtually.
Yep.
Right? We were just talking before, even our workplaces many of us are working from home, and sometimes we'll still check in with our workers through video conferencing just to see another face every now and then, right?
Yeah.
But even things with
a challenge, and sometimes also when you're, we've all seen the memes popping around on Facebook about how family members are starting to look at each other by day 30 of self-isolation, right? Yeah. And it's knowing that it's just been extended for another 28 days. There are some folks that are really concerned about that, and it's just like and there's potential it might be extended longer depending on how quickly we're able to flatten the curve. And doing that. So in terms of some things that you might be able to do if you are feeling kind of trapped in your home, or what are some safe things that you can do on your mental health side of things to kind of connect? So the Zoom meetings are one thing, but what if I wanted to go outside?
Yep. So getting outside is really helpful for our mental health. So you can still be socially distant and take a walk around the block. You can still get outside as much as possible. And we've been kind of making sure their guidelines, and they're still advertising that. Getting out in the environment is great for our mental health, but I think one of the key pieces it does too is it kind of grounds us to the present moment, because a lot of our fears and our worries right now are about future, what's going to happen next, the unknown. And when we get tied up in all those what ifs, we're not actually paying attention to what's happening right now. So trying to be mindful and stay in the present and enjoy, like, what is there to be grateful for in my situation right now?
Mhm. Absolutely. And there are lots of good things that are coming through this too, right? And a great chance to self-reflect. I know a lot of folks are trying to learn a new skill or do different things, right? And it's just like, not like you have to do that or feel like you under pressure to make some big change in your life through all of this. The adjusting to the virus itself is a big enough change, trying to get through all of that.
Definitely.
Right, and it's easy to try and measure ourselves against our friends, and sometimes social media can be our friend, and other times social media and exposure to media can present some challenges. So, what do you say about on the kind of the mental health side of that? What you can do if you start to become feeling very overwhelmed with all the news that you're being bombarded with every day?
Yeah. So, I mean, just thinking about social media for a minute, our social media platforms through Access Open Minds and CMHA Lambton Kent, we're trying to use this as an opportunity to get out credible resources, provide information that's helpful, and having a healthy balance between just positive messages, even like a break from COVID related information, but messages on social media. But it's really important that you take a break, right? So I know myself at the beginning, I was, listening to the public health website, reading up, like listening to what CDC was saying, World Health Organization, which are all credible resources to tap into. But I even realized for myself, like, I need to step away. There's certain amount that it's just too much and you get too stressed and overwhelmed by it. So checking in with yourself, and everybody's going to be different. Some people need more breaks from the information. I like to think about it as I'm going to get that information somehow. Someone's going to tell me, it's going to be all over social media or wherever. I don't have to be seeking it out or on those websites 24/7, because that's not going to be good for my mental health.
Right. And I like how you're talking about the whole self-check-in piece. And for someone who's maybe never had to have done a self-check-in before, I know in the social sector we talk about it a lot in terms of making sure we're not burning out and all that other kind of good stuff. How would you guide someone to, if they wanted to go through a self-check-in process? What are some things or questions they could be asking themselves to just bring that level of awareness to their how they're feeling?
Yeah. So there's actually some websites where you can do like a mental health check-in. So it's like check up from your neck up is one of the things that you can Google and do like a quick little quiz on how you're coping.
Yeah.
But even being mindful, like think about how before COVID, how you coped, how you normally felt, acted, how much work you were able to get. Good and bad days though, right? You could be coping amazingly one day and then the next day you're like, this is not my day. And that's okay. But when we think about, it's important to kind of keep in mind there's multiple areas that affect our overall health. So mental health is one piece, physical health, but there's also our social health, which is going to be much different right now. Our spiritual health too can play a huge role as well. So kind of checking in on all those areas and seeing what's going well, what might I need help with and need to focus on today.
Wonderful. And I know just from personal experience, I've been very open with my own journey, struggling with mental health and addiction at one point in my life. And one of the things that I know we talk about a lot is routine, and how important it is to maintain those routines, and how easy it is to kind of get a case of the quote unquote screw it's, right? And it's just like, why bother? Yada yada yada. And it's just easy, I could sleep in or do this, or I'm not gonna shower today, things like that. And it becomes a slippery slope very, very quickly. And so what would you like to kind of, or what would you recommend for folks that are currently in a situation that's not normal for them, right? It's a new kind of normal that's emerging.
Yes. I would say, we talk about setting those routines. I'll say I'm not the best at it right now, especially with this shift of not being in the office.
Yeah.
So trying as best as you can to stick with your normal routine that works for you. Try to, of course, the basics like eat healthy, get enough sleep, exercise as you can. With all that said, allow some flexibility, right? You can set up a routine, a big to-do list. You might not actually get through it all, or it might not be perfect, and that's okay. We're all kind of adjusting.
Experience. Even though addiction is well in my past, many years behind, I know that these types of periods were particularly on the social side of things and things like that, where we can see higher rates of relapse that are occurring with folks that are reaching out and taking comfort in substances.
Yeah.
And or alcohol, or we could see this show up in a number of different things, right? If we can't bond to happy, healthy connections around us, we'll find something to bond with, whether it becomes online gambling or things like that. There's a lot of different things where some of those, I guess, behaviors that aren't necessarily going to lead to greater happiness in the long run, right?
Yeah.
So what would you say on the mental health side for just some awareness around, becoming dependent upon other substances to kind of help you cope?
Mhm. Yeah, I'd say it's a really common thing that we see. Mental health and substance use goes hand in hand quite frequently. A lot of the times it's, like you said, it's that comfort, right? It's that way of coping with a current stressful situation. It happens multiple times throughout our lives, but this situation in particular is going to increase those odds. So just being mindful of that, and knowing that resources are still out there in the community. If you are noticing it becoming a problem for you and you want support, to reach out as early as possible, and we're there to help you through that.
That's wonderful. Yeah, no, for myself, it is important to kind of set up some pieces where it's like on Sunday afternoons, I'm able to get together with some colleagues and we go for a nice socially distanced walk in the Mapleview Cemetery on Sunday afternoons, which is always lovely. And it's a great way, talk to each other about some of the challenges that we're facing and helping to support everything that's been going on. So I know for me, that's just one thing that I've personally found helpful. And that sometimes, we talk about that first step a lot in being the most difficult. And I know that we see not only with mental health, but with other things, typically when there's some struggling that's occurring, it's usually not the first thing that happens where we're reaching out and getting help. And then that leads into a second thing and a third thing and a fourth thing. And then all of a sudden you've got this big ball of yarn in terms of making it more complicated to connect to support. So we're trying to encourage folks, particularly now, to reach out early in the process, understanding that there's some folks who have been working. So we refer to folks as being part of the ALICE group, so asset limited, income constrained, employed, or sometimes known as the working poor, or people who have been literally working paycheck to paycheck. So we know over 50% of working Canadians have less than $200 in their bank account from paycheck to paycheck. So that's one of the things where it's really, where you've been around these folks that you've been working for the last 15, 20 years, you've been able to make it through. Now all of a sudden you're in a very different position financially, very different position socially, maybe having to reach out and ask for help for your very first time. So what advice would you, or what, I guess what support would you offer for folks that are having to reach out and ask for help for that first time, getting over some of those mental anxiety barriers, and where they can go to actually make that connection?
Yeah. First, I think it's recognizing it's scary to reach out. It takes a lot of courage and bravery to you and whatever you need. It's a hard step, but doing it hopefully will outweigh a lot of the kind of hesitation at the beginning. Hopefully you'll get a lot of benefits from it. So resources like at Canadian Mental Health Association, We're there for anyone in our community, 16 and up. We have our mental health first response team that's available 24/7. We have been seeing an increase in callers that have never reached out to us in the past, right? So we have seen a lot more anxiety and stress related to COVID, and people wanting just, some coping strategies and reminders for self-care. And that's great, right? Reach out to us. That's what we're there for, as well as those times of crisis. In terms of youth supports, we also have Access Open Minds, who's in our community, our new youth hub since, I think, the past 4 years now, which is kind of great to think that we've been up here for 4 years already.
That's crazy, yeah.
Yeah, like time flies, right?
Wow, yes.
Yeah. So we're there for anybody 11 to 25. So we have great peer navigators that can kind of connect with youth virtually. We've actually expanded our single counseling sessions to Monday to Friday, 8:30 to 5 for youth. We know that youth aren't in it alone, right? There's family members, there's older siblings, parents, grandparents. So you can also call if you're a family member and you want your own support to get through this time as well.
And so we are trying to, as all of this information is coming out about COVID from many different sources, we are trying our best to capture most of them through the CK site. And I'm just going to share the screen for a minute just so we can see that. So if you go to ckgives.ca and you're wanting to get help, just click the Get Help tab. And here we have mental health crisis support. So particularly if you're wanting to ask for help now, there's 211, which you can, again, 24 hours a day, 365 days a year, just to help link to the services and where you can turn to for help. Also, you can access online and have a live chat. There's some addiction support right now with certified counselors, Kids Help Phone, the mental health services available for children, youth, and families right now through Chatham-Kent Children's Services. There's a Hope and Wellness line for all Indigenous people. Access Open Minds, what you just spoke about in terms of how to connect through there. Also looking at some of the other supports that you had shared around Bounce Back and the Big White Ball. And there's some other great things in terms of the Canadian Mental Health Association first response team. And so particularly if you're, if you're feeling anxiety, definitely a place to call. Definitely if you're experiencing thoughts of suicide, another great way to connect. And it's available, as you said, 24/7. And of course, if you're ever in that situation, calling 911 or visiting your local emergency room when experiencing thoughts of suicide is always a welcome place to go as well, where there are people who are able to provide support. So from that, it's just page as well. There's, if we talked a little bit earlier about being one of those families that, maybe this is the first time you've had to reach out and access assistance, whether there's education, so you've got kids at home that you're needing to support right now, whether you need to access emergency food support and resources right now as well, or you're requiring delivery services. All of that information we've tried to pull together and at least link here. So we're not hosting any information ourselves on the site. We're just linking, directing, and connecting to the sources that are being maintained. And we're trying, as you mentioned earlier, making sure we're connecting folks to credible, trustworthy sources of information that there's a lot of, as we've seen from social media, just because you saw it on the internet doesn't mean that it's real, right? And a lot of things that, through that too, where there's a lot of misinformation that's being sent around, which can really cause a lot of anxiety as well. And so really being able to kind of get the facts and understand what's going on. And the folks at the CMHA and Access Open Minds are really helping to connect on the mental health side of things to ensure that you are getting to good quality care during this time. So is there anything else, Megan, that you'd like to cover off?
I think just the key piece of take care of your mental health, do those check-ins each day, and keep track and follow us on social media for CMHA and Access Open Minds, because we're constantly posting resources and we are looking at providing some of our ongoing groups on virtual platforms. So we'll be sending that information out as soon as we get it.
That's incredible. So, Megan, always a pleasure to be able to talk to you, and thank you for all the work you've been doing in the community and out of the CMHA and Access Open Minds. And we're very 3 o'clock, and yeah, we look forward to connecting with you tomorrow. If you have any questions, please post them in the comments below. We will respond to you as soon as we're able to